Hello, I'm Trish and I work at the Macmillan Cancer Information Centre at Chase Farm Hospital, part of the Royal Free London NHS Foundation Trust. This video is part of our small collection of films and contains hints and tips you can use at home to help you manage a poor appetite while you're having cancer treatment. It's our second video on this topic and is specifically for those who have been prescribed nutritional supplements. If you would like to try any of the tips in this video, please check with your doctor or dietitian first. If you've been given a specialist diet by your medical team, please also make sure that you carry on with it and check that they confirm whether any of these tips are suitable for you. Supplements come in different forms, from powder that you mix or ready to drink milkshakes to ones that are more like juice. There are also ones that are savoury or pudding-like. These are fine as they are, but you can also add things to supplements to make them more varied or to incorporate them into a meal. There are also flavourless supplements that can be added to meals without altering the taste. So remember that you can ask your doctor to prescribe a different type or flavour if you need to. If you find your supplement too sweet, you can dilute the juice type ones with water, crushed ice, soda or carbonated water. To the milky types you could try adding some milk or blend them with fruit or ice cream. With some chemotherapy drugs though, you should not have ice or very cold foods, so do first check with your clinical team if you're not sure. You can try adding things like mint leaves, fruit slices or cinnamon to your supplement and perhaps serve it in a smaller, more attractive glass to make it more appealing. An opaque or coloured glass can hide how much you have left to drink, which some people find helpful. You can make supplements into jelly or freeze them into lollies, ice cream or flavoured ice chips. Different companies offer a range of recipe ideas on their websites. These can be anything from smoothies to desserts or even main courses. I'll just demonstrate two simple recipes to get you started. Remember to adapt them for any food allergies or intolerances you may have. You could try making a nutritious coffee or mocha with different types of supplement. If you have Ensure Plus Advance or Compact, say chocolate or vanilla flavour, you can gently heat it in a pan. Don't boil it as this could damage the nutrients. In the meantime, dissolve a teaspoon of instant coffee or hot chocolate powder in 3 teaspoons of hot water in a mug. Then pour in your warm supplement, stir and either have it as it is or make it extra special with some chocolate sprinkles, nutmeg or some whipped cream. If you happen to have a coffee flavoured supplement, you can just gently warm this and drink it as it is. A simple example for breakfast is apple porridge, a creamy porridge made with apple water juice. Put the oats and milk in a medium-sized pan and stir constantly over a gentle heat until just simmering. Keep stirring while it simmers for 1 minute. Blend in the water juice a little at a time to make a smooth porridge. Bring to simmering point again and remove from the heat. Place the porridge in a bowl. Stir in the cream or yogurt and top with stewed apples and raisins. Ask your Macmillan Cancer Information Centre for details of other recipes or for more information on managing side effects.